Imagine you're lying on a wooden table. A doctor leans over you with a club. He swings and hits you on the head with full force. You lose consciousness, and only then does the surgery begin. No, this isn't torture. This is a real medical practice used until the 1700s. Now picture this. You get an injection of white liquid that looks like milk. 30 seconds later, you fall asleep. No pain, no nightmares. You wake up. Surgery's done. Between these two scenes lie 5,000 years of searching, dozens of deaths from experiments, and the story of how gas parties accidentally led to the greatest discovery in medicine. Today I'll tell you the shocking history of anesthesia. From opium potions in ancient Egypt to modern milk of amnesia. You'll learn why the discoverer of anesthesia cut his artery in prison, why a Chinese surgeon was executed for suggesting brain surgery. Let's go. To understand the scale of the problem, imagine yourself in the ancient world. Your appendix is inflamed, or you need your leg amputated. In ancient Egypt, around 1500 BC, doctors gave patients opium-based tinctures. Nobody controlled the dosage. Too little, patients screamed. Too much, died from overdose. In ancient China and India in the 2nd century AD, they used a mixture of wine and powdered marijuana. Legendary Chinese surgeon Hua Tuo invented a drug called mafei-san, a mix of datura, aconite, and poisonous plants in alcohol. This man opened bellies, removed parts of spleens, washed abdominal cavities. In the 2nd century AD. Europe didn't reach this level for another 1700 years. But know how Hua Tuo's story ended? His patient was ruler Cao Cao, who suffered from headaches. Hua Tuo suggested brain surgery. Open the skull and remove the tumor. The ruler decided the doctor wanted to kill him and ordered Hua Tuo executed. Medical library burned. The mafei-san recipe lost forever. In South America, the Incas invented their own method. A healer chewed coca leaves, which cocaine is made from, then spit that saliva on the wound, and cocaine slightly numbed it. In ancient Egypt, doctors compressed the carotid artery until unconsciousness. In China, they hit the head with a heavy object or inflicted wounds so blood loss would cause fainting. Remember the beginning? The club strike. This was real practice until the 1700s. Surgeons were valued not for quality, but for speed. The best was whoever could cut off a leg in 2 to 3 minutes, because patients woke up from pain and screamed. With technology development, they learned to make strong alcohol. Armies took supplies of vodka and rum on campaigns as medical supplies. They gave a wounded soldier a bottle to drink, he'd get blackout drunk. This method is still used today in critical situations when there's no access to modern drugs. In the 1300s, Spanish scientist Raymond Lully discovered ether, and in 1540, the famous Paracelsus described its pain-relieving properties. But nobody took it seriously. Why? Because hypnosis became hugely popular. Doctors put patients into magnetic sleep before operations. Of course, patients woke up screaming from pain and horror. But the real nightmare was described by British surgeon Robert Liston. Once he performed surgery to remove bladder stones, the pain was so unbearable that the patient broke free from the couch, ran out of the operating room, and locked himself in the bathroom. Liston had to break down the door and carry the man back in his arms, finish the operation under screams and pleas for mercy. This was normal medical reality, and ether was waiting for its moment. And that moment came thanks to parties. Early 1800s, America. Young people invent entertainment, ether parties, and gas shows. People inhaled ether or nitrous oxide, laughing gas. 1845. Young dentist Horace Wells attends a nitrous oxide show. He gets an idea. What if we use this in medicine? He arranges a public demonstration at Harvard Medical School. The hall is full of doctors. Wells lets a patient breathe the gas and starts extracting a tooth, but he miscalculates the proportions. The gas didn't work fully. The patient groaned in pain. The hall explodes with laughter. Charlatan! Fraud! Wells was booed and kicked out. He couldn't handle the shame, fell into depression, got hooked on ether and chloroform. Under the influence of drugs, he poured sulfuric acid on two women's clothes. Ended up in prison. And there, in January 1848, Horace Wells cut his femoral artery. He was 33 years old. Justice was restored only after his death. Meanwhile, another doctor, Crawford Long, was also throwing ether parties in Jefferson, Georgia. And he noticed something strange. Participants got bruises and fractures, but nobody remembered pain. Long realized ether can be used in surgery. He had a patient who needed cysts removed from his neck, but the patient was terrified of pain. March 30th, 1842. Long soaks a towel with ether. Patient inhales and falls asleep. Long removes the cyst. Patient feels nothing. This was the first ether anesthesia in surgery in history. Long was 26 years old. In December 1845, he was first to use anesthesia in obstetrics. But Long was a modest doctor. Published his scientific paper only 7 years later. Glory went to others. June 16th, 1878, he was delivering a baby. Suddenly he felt ill. Last words, "Take care of the mother and baby first." He died that same day. Boston, October 16th, 1846. This date is the birthday of anesthesiology. Young dentist William Morton conducts a public demonstration of ether anesthesia. Morton learned from Wells's mistake. Patient, a young man with a neck tumor. Morton has him breathe ether. Patient falls asleep. Chief Surgeon John Warren begins the operation. Complete silence in the hall. Patient sleeps peacefully, doesn't scream. Surgery completed. The hall erupts in applause. Warren speaks the historic phrase, "Gentlemen, this is no humbug." News spread worldwide in weeks. In March 1847, 5 months later, Russia performed its first operations. February 7th, Professor Fyodor Inozemtsev at Moscow University. February 14th, Nikolai Pirogov in St. Petersburg. Summer of 1847, Pirogov made a breakthrough. During the Caucasian War, he was first to use ether anesthesia in field conditions. Performed about 300 anesthesias in 1 year. Ether was a breakthrough, but it had problems. Unpleasant smell, airway irritation, explosion risk. Doctors continued searching. From 1879 to 1884, Russian scientist Vasily Anrep and German ophthalmologist Karl Kohler discovered cocaine's pain-relieving properties. In 1880, American surgeon William Halsted used cocaine for tooth extraction. Cocaine became the first local anesthetic. But there was a terrible problem. November 18th, 1884, St. Petersburg. Dr. Sergei Kolomnin injects a patient with cocaine. 3 hours later, the girl is dead. First death in history from medical cocaine overdose. Kolomnin couldn't handle it. Several days later, he shot himself. In 1898, German surgeon August Beer injected cocaine into spinal fluid and achieved spinal anesthesia. The entire lower half of the body lost sensation. In 1905, German chemist Alfred Einhorn synthesized novocaine. This drug was safer, non-addictive. Russian surgeon Alexander Vishnevsky understood. Why put the whole person to sleep when you can just freeze the needed spot? In 1943, Swedish chemist Nils Lofgren synthesized lidocaine, an even more advanced anesthetic. And in the 70s, articaine and ropivacaine appeared. Now we've reached modern times. The drugs doctors use right now. 1986. Propofol enters the market. Doctors nicknamed it milk of amnesia. It's a white liquid that looks like milk, an emulsion based on soybean oil. Propofol revolutionized everything. Acts instantly, 30 seconds and patients asleep. Quick recovery without nausea or headache. Easily controlled by doctors. Propofol has a special feature. It causes amnesia. Patient forgets everything that happened during anesthesia. That's why they called it milk of amnesia. By the way, Michael Jackson died from propofol overdose in 2009. His doctor gave propofol as a sleeping pill, which is forbidden. In 1968, sevoflurane was synthesized, trade name Sevorane, modern third-generation anesthetic gas. Doesn't irritate airways, can be used with children. Sevorane is administered through a mask. You breathe the gas, you fall asleep. You stop breathing it, you wake up. For local anesthesia, they use articaine, ropivacaine, bupivacaine. Modern anesthesia is a multi-component system. Doctors combine drugs for the perfect effect. Amnesia, analgesia, muscle relaxation. Everything is monitored in real time with monitors. Let's summarize this 5,000-year journey. From opium in ancient Egypt in 1500 BC to propofol in 1986. Today, anesthesia is one of the safest procedures. Out of 300,000 patients who get anesthesia, one dies. From club to perfection, from horror to comfort. This is the history of anesthesia, one of humanity's greatest achievements.